Let's talk about how you follow sometimes complex schedules and regimens for Parkinson's disease. Parkinson's disease can be treated symptomatically relatively well with medications. There are a number of medications that are available, and they all produce some degree of symptomatic relief. However, as the disease advances, the duration of levodopa effect shortens, and it will require to use more complicated medication regimens, including the use of extenders and reducing the interdose interval. A lot of patients experience the immediate on response from their medication, and therefore are tempted to take medications on an as-needed basis. As they wear off, they take it. If they don't wear off, they don't take it. I encourage to take medications on a strict schedule, no matter how the symptoms are, allowing the brain to get accustomed to a replenishment or stimulation from the external dopaminergic agents. Taking the medications in a haphazard, random, or as-needed manner can only make things worse in several ways. That brings us to the question as to how to keep or how to adhere to a complicated schedule of taking medicines, sometimes every 3 hourly or even more frequently. It may be a challenge for most patients, but it's especially a challenge for patients who work and may get easily distracted from when they need to take their medication, because they may not have symptoms at that time. Nevertheless, they need to remember to take the medications. There are several ways of helping with this problem. There are pill boxes which are perfectly useful for the Parkinson's patients, in which you can sort and group your pills for the entire day in advance, and then you don't have to scramble finding the multiple pills at multiple places, but they are all at one place. Also, remembering the medications, remembering the time when you take your medications could be a challenge. Fortunately, there are many options available now on the commercial market in the array of reminders, alarms, and other devices that are supposed to help you remember the time to take your medicine. These include keychains, watches, pagers, and electronic pill boxes. These are all available commercially and are being used by a number of patients worldwide, and our experience is that they do help with adhering to a complicated regimen. To ensure that you follow a complex regimen of your Parkinson's medications, you first need to generate a detailed list of all your medications with the time that you are supposed to take them, and also note for what you're taking them. It is advised that if you are taking medications for other disorders than Parkinson's disease, you just include all of them in the same list. It is important for you to understand which medication is used for what, and keep that list available to you at some prominent place. Patients find it useful to tape their list of medications and regimen on the refrigerator in the kitchen. A smaller list may be good to keep in your wallet. And that's always a good point to start with. Get the information from your doctor in as detailed manner as possible as to what medications you are taking, when did you start taking them. It's also an important piece of information. What times, how much, and for what you're taking them.